Joining us now on the line is Muriel Bowser, a council member representing Ward 4. She is currently the Democratic nominee to become the next D.C. mayor. And congratulations on your primary win. I don't think we've talked to you since that occurred.
No, we haven't, but thank you for your kind words, and I'm happy to be here this morning.
All right, so let's talk about this thing that you laid before the city council yesterday. You are proposing that the blood alcohol levels in the District of Columbia, which are currently set at 0.08, if you're blowing 0.08, you are drunk in the District of Columbia. You'd like to see that lowered to 0.05. This is the recommendation, by the way, of the NTSB, but no state has yet gone forward with that recommendation. You believe D.C. should be first. Why?
I do. I believe that we need to make our streets safer, and the data are pretty clear that when drivers and a lot of accidents are happening below the 0.08 level, and a lot of very serious accidents are happening at that level. So the National Transportation Safety Board issued a very clear recommendation about a year ago based on experience of a lot of European countries where fatalities and traffic accidents have been severely mitigated and the streets safer.
All right, so you want to make the streets safer. That's the main reason that you're behind this idea, right?
Absolutely.
Well, I mean, I guess many people look at this and they say, okay, well, what's the reward versus the benefit? I mean, what's the risk versus the benefit? And if you want to make streets safer, there are a lot of ways you could do it. You could, by law, decide that the speed limit in the District of Columbia is 7 miles an hour. And that would save lives, would it not?
Yes, actually, but it would also probably be unenforceable.
Well, and some people wonder, how do you tell somebody's got 0.05 blood alcohol? I mean, how do you know when you're driving down the street that person has 0.05? What's going to draw your attention? It seems like to me that's sort of a very low level, because we've read some information that says you can go to a bar, you can have a couple of glasses of wine, and you would be in violation of this law.
Well, if you're impaired and you're driving, then you shouldn't be.
Well, do you think that most people can drink a couple of glasses of wine, get in a car, and it'd be pretty hard to tell whether they're impaired, wouldn't it?
Well, that they would demonstrate. They would demonstrate if they were impaired, just like police are able to tell when somebody is at 0.08.
Councilmember Muriel Bowser is our guest, and she's also the Democratic nominee for D.C. mayor. Let's talk about your upcoming race against David Catania. What do you think is the reason why people should vote for you over Mr. Catania?
Well, I'm the only one on the ballot. We enjoyed a great Democratic primary win. We've been out talking to voters for the last 15 months about what's important to them. They told us very directly they wanted a fresh start. They knew that I had the experience to bring our city together so that we didn't have progress just in the downtown, but that we had progress in all 8 wards of the District of Columbia. So we're going to stay focused on schools, growing our middle class, and attracting the best and brightest to work for us.
Let me ask you about something you guys just approved on Tuesday, and that is a 1% tax on health care products. Apparently, this 1% tax is meant to make up for some operating costs for the D.C. Health Exchange, basically the D.C.'s version of Obamacare, the Affordable Care Act. Why this new tax? Because we were told that the Affordable Care Act wasn't going to increase anybody's taxes.
Well, what the federal government requires is that the exchanges that are operated by the states be self-sustaining by next year. And we have, our health benefits exchange looked at what the number of people participating in the pool and what they've been able to derive from their participation, and it won't be enough to cover the operating costs.
So
but this is not a surprise to us. It's been studied by our health benefits exchange for over a year, and a broad base of stakeholders, including the insurance companies, think that this is the most fair way to do it.
All indications are that costs for health insurance and health care are just going to go up, so that means we're going to increase that tax now. Now that it's implemented, it's 1% now. How high is too high?
I don't know that we have found that all insurance is going to go up in the District of Columbia. What we found is that more people are insured, which is a bottom line good thing for us. because sick people don't disappear just because they don't have insurance. They show up in our hospitals, and those costs eventually get passed on to consumers. So what's the most efficient way to serve those people? And we believe the most efficient way is for them to have insurance, to have a doctor so that they're practicing preventative care and staying out of emergency rooms. Now, you raise a good point. We shouldn't give the benefits exchange a blank check. And if I have concerns, it's that maybe the 1% assessment is too much. Maybe they don't need $29 million to operate. We know that this is their second year. The startup costs for this operation have been significant, and my expectation would be that they go down over the years to come, not up. And we have to have a mechanism in the law to refund the insurers, and thereby refunding consumers the money that they don't need.
You know, Larry and I of late have sort of been feeling, and it's an anecdotal feeling, that maybe in the District of Columbia, you know, it's getting a little rougher, a little meaner out there on the streets of D.C., and that the crime rate might be going up. Then we see this story in the Washington Post that says the murder rate is up 75% compared with this time last year. The city has averaged 9 murders a month over the past 4 months, and many of these occurred, we are told, in broad daylight. Do you believe that crime is on the uptick in D.C.?
Well, I know that it is, and I know that especially in certain neighborhoods, they are experiencing an even more steep increase.
Well, let me stop you there, because we keep hearing this. Well, in certain neighborhoods, in certain areas, are we sugarcoating it? Isn't this gang activity in some neighborhoods?
I don't know that I would say that. What I would say is that oftentimes there are kind of some entrenched criminal activities, and that we're finding that the people involved in those activities are shooting each other. We fortunately are seeing, younger people involved in some of these crimes as well. But the last thing, and this is what concerns me as a person who grew up here and has seen D.C. in its most violent days, is that we put an immediate stop to the violent activity from the police end. But on the front end, we know that we have summer coming up, and kids and young people having more time that we get in front of this violence so that we don't see these homicides or shootings go up in our city.
All right. Muriel Bowser, thank you so much. Always a pleasure to have you.
Thank you.
Hope you'll come back as the campaign goes forward.
Of course I will. I'll be here. Bye-bye.